Hello, my name is Miss Tina Khanam. I'm an ophthalmologist working in London. Today I'm going to talk to you about conjunctivitis. Now, what is conjunctivitis? It just means the white of your eye becomes inflamed, and you may have symptoms such as redness in the eye or discharge coming out of the eye. Or just watering and streaming of the eyes. So the types of conjunctivitis I would like to tell you about are bacterial, viral, and allergic type of conjunctivitis. As with most of us who suffer from hay fever, you can get allergic conjunctivitis in hay fever. So you will get, with pollen season, you'll get redness of the eye and streaming of the eye. And you can use over-the-counter drops such as anti-allergy drops to reduce the symptoms completely for the allergic conjunctivitis. For the bacterial conjunctivitis and the viral conjunctivitis, you may need to get much stronger things than you can get over the counter. So you can get chloramphenicol over the counter, and that can target all the bacteria or most of the bacteria that causes bacterial conjunctivitis. The viral ones are self-limiting. So what we mean by that is virus can be of many kinds, and there are not that many antivirals in the market. Your immune system, if you are strong enough, should be able to fight the viral conjunctivitis, and it can be self-limiting in terms of lasting for a few days to a week or so. So in those cases, for the viral conjunctivitis, what you can do at home is, again, use cold compress that will relieve some of the symptoms, use lubricating drops that's over the counter that will relieve some of your symptoms. And if you're struggling, then obviously see an ophthalmologist or an optometrist if your over the counter medications are not working. Some of the viral conjunctivitis can be serious and can be very painful and uncomfortable, because what they do is they affect the skin layer of your cornea as well as the white of the eye. And I'm not sure whether you know, the skin layer of your cornea or window of your eyes is the most densely populated nerves you can find anywhere in the body. So any scratch to that surface will cause immense discomfort for you. So you will need to see an ophthalmologist in that case. So we have talked about viral, bacterial, and allergic. There are this small group called fungal conjunctivitis, and that can happen very rarely, especially for patients who are immunocompromised or people who work in the farm, and in that way they got the fungal conjunctivitis. But they will have other things that are going on apart from the conjunctivitis in that case. So it's very important to seek help at the right time, and there are things you can do in the meantime before you see your doctor to alleviate some of your symptoms. So conjunctivitis can be quite contagious, especially the viral kind, like adenoviral conjunctivitis. So you want to make sure you limit the spread. What I tell my patients is be very mindful of your hygiene. So if you're putting your finger in your eye and then touching a surface, and someone else comes along and touches that surface, they will get your conjunctivitis. So make sure you don't touch the eye, for example, would be the first thing to do. And also don't share your flannel or your face towel, and be mindful that if you're sharing a bed with your spouse or your partner, that you need to make sure that they're not using the same pillow or the pillow covers, and you're segregating yourself, so you're containing the conjunctivitis infection.